Rheumatoid arthritis, RA, is a long-term autoimmune condition that affects joints on both sides of the body. It causes pain and swelling in areas such as the fingers, hands, wrists, knees, ankles, feet, toes. This symmetry sets RA apart from other types of arthritis. Uncontrolled inflammation in rheumatoid arthritis can damage cartilage, which cushions the joints. Over time, this damage can deform the joints and lead to bone erosion. In severe cases, the bones may fuse to protect against constant irritation. Specific immune cells contribute to this process, releasing substances that not only affect the joints, but can also impact other parts of the body like the skin, eyes, mouth, lungs, heart. Who gets rheumatoid arthritis? Rheumatoid arthritis affects over 1.3 million people in the U.S. It is about 2.5 times more common in individuals assigned female at birth than those assigned male at birth. What's the age of onset for rheumatoid arthritis? Rheumatoid arthritis typically begins between ages 30 and 60, but it can affect anyone. When it starts between ages 16 and 40, it is called young onset rheumatoid arthritis, YORA. If symptoms appear after age 60, it is referred to as later onset rheumatoid arthritis, LORA. What are the symptoms of rheumatoid arthritis? Rheumatoid arthritis can vary in how it affects people. Some experience gradual joint symptoms, while others may see rapid progression. Many have periods of symptoms, flares, followed by times of remission. Common symptoms include pain, swelling, stiffness, and tenderness in multiple joints. Morning stiffness or after long periods of inactivity. Pain and stiffness in the same joints on both sides of the body. Fatigue, weakness, fever. What are rheumatoid arthritis flare symptoms? Rheumatoid arthritis flare symptoms are similar to regular RA symptoms, but occur after a period of improvement. Flares involve increased pain, swelling, and stiffness, often triggered by stress, weather changes, certain foods, or infections. While flares can't be completely prevented, tracking your symptoms in a journal and sharing it with your rheumatologist may help identify and manage triggers more effectively. What causes rheumatoid arthritis? The exact cause of rheumatoid arthritis is unknown, but it's believed to result from a combination of genetics, hormones, and environmental factors. Normally, the immune system defends the body, but in RA, something triggers it to attack the joints. Possible triggers include infections, smoking, or physical and emotional stress. Is rheumatoid arthritis genetic? Rheumatoid arthritis has a genetic component, with certain genetic variations increasing the risk. Variations in human leukocyte antigen, HLA genes, which help the immune system differentiate between the body's proteins and foreign proteins, are linked to a higher likelihood of developing RA. Non-genetic factors like sex, exposure to pollutants, and irritants also play a role in RA risk. What are the risk factors for developing rheumatoid arthritis? Several factors can increase the risk of developing rheumatoid arthritis, including family history. Having a close relative with RA raises your risk. Sex. Women and those designated female at birth are 2 to 3 times more likely to develop RA. Smoking. Smoking both increases RA risk and can worsen the disease. Obesity. Obesity is linked to a higher likelihood of developing RA. How is rheumatoid arthritis diagnosed? To diagnose rheumatoid arthritis, a healthcare provider, usually a rheumatologist, will assess your medical history, conduct a physical exam, and order blood and imaging tests. Blood tests help detect inflammation and specific antibodies linked to RA, including erythrocyte sedimentation rate, ESR, for joint inflammation, C-reactive protein, CRP, rheumatoid factor, RF, found in about 80% of RA cases. Antibodies to cyclic citrullinated peptides, CCP, present in 60 to 70% of people with RA. Imaging tests such as X-rays, ultrasounds, or MRIs check for joint and bone erosion. In some cases, the provider may monitor symptoms over time to confirm the diagnosis. What are the diagnostic criteria for rheumatoid arthritis? To diagnose rheumatoid arthritis, healthcare providers use a set of signs, symptoms, and test results based on research and clinical practice. While some may not meet all criteria, the general diagnostic criteria include inflammatory arthritis in two or more large joints, such as shoulders, elbows, hips, knees, or ankles, inflammatory arthritis in smaller joints, positive biomarkers like rheumatoid factor, RF, or CCP antibodies, elevated CRP or sedimentation rate, SED rate, symptoms persisting for more than 6 weeks. What are the goals of treating rheumatoid arthritis? The primary goal in treating rheumatoid arthritis is to reduce joint pain and swelling, which helps maintain or improve joint function. Long-term treatment aims to slow or halt joint damage, and controlling inflammation also helps improve overall quality of life. How is rheumatoid arthritis treated? Early treatment is crucial to prevent long-term joint damage, often occurring within the first 2 years after diagnosis. Treatment options for rheumatoid arthritis include lifestyle changes, therapies, medications, and, in some cases, surgery. Providers tailor treatment plans based on age, health, medical history, and symptom severity to manage and slow the progression of the disease effectively. What medications treat rheumatoid arthritis? Medications for rheumatoid arthritis reduce joint pain, swelling, and inflammation while preventing or slowing disease progression. Early, targeted treatment can improve long-term outcomes, with combination therapies often being as safe and effective as single drug options. Common medication types include non-steroidal anti-inflammatory drugs, NSAIDs. These reduce pain and inflammation and include options like ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin. COX-2 inhibitors. A type of NSAID, COX-2 inhibitors like celecoxib, Celebrex offer anti-inflammatory effects with fewer stomach bleeding side effects than typical NSAIDs. Corticosteroids. Corticosteroids or steroids help reduce pain and inflammation. Common examples include prednisone and cortisone. Disease-modifying anti-rheumatic drugs, DMARDs. DMARDs work by slowing the disease progression through immune system modification. They may be prescribed alone or combined with steroids or other medications. Common DMARDs include methotrexate, Trexol, hydroxychloroquine, Plaquenil, sulfasalazine, azulfidine, leflunomide, Arava, Janus kinase, JAK, inhibitors. JAK inhibitors are a type of DMARD often used when methotrexate alone isn't effective. Examples include tofacitinib, Xeljanz, baricitinib, Olumiant. Biologics. If DMARDs are ineffective, biologics may be prescribed. These drugs target specific molecules driving joint inflammation and tend to work quickly, often within 2 to 6 weeks. Biologics can be used alone or with DMARDs like methotrexate. Biologics generally act quickly, with effects appearing in 2 to 6 weeks. They may be prescribed alone or with a DMARD, such as methotrexate, for enhanced effectiveness. What is the safest drug for rheumatoid arthritis? The safest medication for rheumatoid arthritis is the one that provides maximum benefit with minimal side effects, tailored to each patient's health history and symptom severity. Providers work closely with patients to develop personalized treatment plans, monitoring for side effects and adjusting medications as needed. Regular checkups and tests help ensure treatment effectiveness and safety. Will changing my diet help my rheumatoid arthritis? While dietary changes alone won't cure rheumatoid arthritis, they may help reduce inflammation and ease symptoms when combined with other treatments. Your doctor might suggest adding healthy fats and reducing salt, processed carbs, and unhealthy fats. Although no supplement can cure RA, managing diet under the guidance of a rheumatologist is safe and beneficial. Other lifestyle changes like weight loss can relieve pressure on inflamed joints. RA patients are also at a higher risk for coronary artery disease, so a nutritionist may recommend foods that support heart health and lower cholesterol. When is surgery used to treat rheumatoid arthritis? Surgery may be considered for rheumatoid arthritis when joint damage is severe or pain isn't manageable with medication. Procedures that help restore joint function include knee or hip replacements and corrective surgeries for deformities. What is the prognosis for people with rheumatoid arthritis? While rheumatoid arthritis has no cure, effective treatments can help manage pain, reduce inflammation, and slow disease progression. Early diagnosis and prompt treatment are key for a better long-term outlook. What types of lifestyle changes can help with rheumatoid arthritis? Managing rheumatoid arthritis may feel challenging, but certain lifestyle changes can support your quality of life and help manage symptoms. Rest. Resting inflamed joints reduces the risk of injury to surrounding tissues like tendons and ligaments. However, staying active is still essential for maintaining joint mobility and overall fitness. Exercise. Regular movement helps counter pain and stiffness. Inactivity may lead to reduced joint motion and muscle strength, which can increase pain and fatigue. Physical or occupational therapists can offer guidance on safe exercises, including range of motion exercises to maintain joint flexibility, strengthening exercises to support joint stability, endurance activities like walking, swimming, and cycling to boost stamina. What are the early signs of rheumatoid arthritis? Early signs of rheumatoid arthritis often begin as tenderness or pain in smaller joints, like fingers or toes, or sometimes in larger joints, such as the knees or shoulders. These early symptoms can be subtle, but recognizing them early is key. Early diagnosis and prompt treatment can help prevent lasting joint damage and pain. What are the 4 stages of rheumatoid arthritis? First stage 1, early RA. Inflammation around the joints begins, causing pain and stiffness. X-rays typically do not show bone damage. Second stage 2, moderate RA. Inflammation starts to damage the cartilage, leading to more stiffness and a reduced range of motion. Third stage 3, severe RA. Inflammation becomes severe enough to damage the bones. Pain, stiffness, and physical changes increase, further limiting movement. Fourth stage 4, end stage RA. Inflammation ceases but joint damage continues, resulting in severe pain, swelling, stiffness, and significant loss of mobility. What is the difference between rheumatoid arthritis and osteoarthritis? Both rheumatoid arthritis, RA, and osteoarthritis, OA, lead to joint pain and stiffness, but differ in their causes. Osteoarthritis occurs when cartilage deteriorates due to wear and tear, leading to joint damage over time. In contrast, rheumatoid arthritis is an autoimmune condition where the immune system mistakenly attacks the joint lining. Rheumatoid arthritis versus gout. Rheumatoid arthritis and gout are types of arthritis that cause significant joint pain. Gout is triggered by the accumulation of uric acid crystals, leading to sharp, intense pain, usually starting in the big toe. In contrast, rheumatoid arthritis arises from the immune system attacking the joints, causing ongoing inflammation and joint damage. Can rheumatoid arthritis go away? No, rheumatoid arthritis doesn't go away. It's a lifelong condition. However, you may experience periods where symptoms lessen or even disappear, remission, but these times are temporary and can come and go. The damage RA causes to joints, particularly cartilage, is permanent. Without proper treatment, the disease can result in lasting joint damage and may also harm organs such as the lungs and heart. A note from Optimal Best Health. If you have rheumatoid arthritis, it may feel like you're navigating a lifelong roller coaster of pain and fatigue. Remember to share your symptoms and how you're feeling with your healthcare provider. Beyond X-rays and blood tests, your experience of your quality of life is vital for informing your treatment plan. Your provider will assess your condition and recommend personalized treatment options. With the right approach, many people are able to manage rheumatoid arthritis and continue doing the activities they love. Thanks for watching. Don't forget to subscribe to our channel, like this video, and share it with your friends and family. Stay tuned for more health tips from Optimal Best Health.